Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Spina bifida is a birth defect that can have effects ranging from mild to severe and requires specialty care, which Upstate Medical University provides through its Spina Bifida Clinic. The clinic was recently reaccredited, and its caregivers recently participated in the Spina Bifida Association of New York State annual conference in Syracuse. Today, I'm talking with Dr. Nienke Dosa, who is a professor of pediatrics at Upstate and the medical director of the Spina Bifida Clinic, and Julia Duff, who is the executive director of the Spina Bifida Association of New York State. Welcome both of you to The Informed Patient.
Thank you. Thanks for having us.
Dr. Dosa, can you tell us how many families are impacted by spina bifida?
At our regional Spina Bifida Center here in Syracuse, we follow about 125 kids up to age 18, sometimes up till age 21 years. And we also have an adult Spina Bifida clinic, and the medical director of that clinic is Dr. David Cantor in the Department of Physiatry.
How many babies per year are born in Central New York with spina bifida?
So that varies between 4 to sometimes some years it's 8 to 10 babies born with spina bifida. And we might talk about this later, but often these infants have fetal surgery at Children's Hospital of Philadelphia, and they come to us after being cared for at that regional center.
So it can be diagnosed before birth?
Yes, typically spina bifida is diagnosed prenatally. There's screening studies that are done mid-pregnancy, and if the screening studies suggest that the pregnancy might be affected by spina bifida or a neural tube defect, an ultrasound study is done, and that typically is how parents learn that they're carrying a baby with spina bifida.
So those ultrasounds are key for the diagnosis.
Yes.
Can you describe what spina bifida is?
It's a condition that affects the spine, and it's usually apparent at birth, and it's one of the neural tube defects. That's the medical term. It can happen anywhere along the spine if this neural tube does not form properly very early on in pregnancy. When the neural tube doesn't close all the way, the back, there can be a little opening or sac with the spinal cord. And when the baby's born, the neurosurgeon closes that sac. And then we at our Spina Bifida Center follow the infant and child going forward.
Are all of the babies diagnosed before birth, or do you ever have a child that's born and then you later diagnose spina bifida?
So we do sometimes encounter infants who are diagnosed at birth. And the reason for that is that there are different types of spina bifida. When we talk about, when we use that term, typically we talk about the more severe form of spina bifida called myelomeningocele. But we also definitely follow children who have milder versions of spina bifida. Often those children have a closed skin covering over the spina bifida, and the screening studies might not identify those babies. So yes, we do sometimes encounter infants who are diagnosed at birth.
I just want to add, spina bifida occulta is the most mild form, and that is the one that can be diagnosed after birth or later in life.
Dr. Dosa, you said neural tube defect. Is that what this is?
Yes. And there's a lot of confusion around the terminology with spina bifida and neural tube defects. So the neural tube is the nervous system very early on in embryogenesis. We call that the neural tube. And if there is an abnormality with how the neural tube closes very early in pregnancy, so at 22 to 25 days of pregnancy, depending on where the neural tube doesn't close properly, you can have different forms of neural tube defects. And the most severe form is called encephalocele. And those pregnancies are not compatible with life, but the neural tube defects that affect the lower part of the spine rather than the brain. Those embryos are carried through term, and those children are born with different types of defects in the spine. So it can be just the vertebrae can be incompletely formed in the lower part of the spine. And I think that's what Julia was referring to. And again, the terminology is very confusing. That is called Spina Bifida occulta. And I would say it's maybe 15% of the population has that. And it's what we call an incidental finding on the x-ray. Okay, so it's not something we are concerned about as causing symptoms. And so the terminology is confusing because it's called Spina Bifida occulta. However, if there is a marking over the skin, like a hair tuft or a birthmark, or sometimes a little fatty tissue, if there's some sort of sign on the skin overlying the spine, then we get ultrasound studies and we look for what's called occult spinal dysraphism. So that's where the terminology is so confusing. It's just Latin words, but what it means is that occult spinal dysraphism means hidden abnormality of the spine, and the markings on the skin overlying the spine are an indication to get the ultrasound and MRI studies. And sometimes those babies are followed by our neurosurgeon, and they benefit from surgery to detether the spinal cord. Those infants do need to be evaluated. Some have no symptoms, but some do require proactive surgical intervention. And so that's the milder end of spina bifida. The myelomeningocele version of neural tube defects or spina bifida, and sometimes spina bifida and myelomeningocele are terms that are used interchangeably. That means that the meninges are covering up the spine, and the myelo, or that the spine itself, is in the sac, in that little opening that is noted at birth, in which the neurosurgeon closes. So those children do need to be monitored. They can have paraplegia or weakness in the muscles of their legs. They can have numbness in the skin in the legs. And the nerves going to the bowel and bladder come from the spine. So those children often also have what we call neurogenic bowel and neurogenic bladder. And there's a lot to explain about spina bifida, but because there's that opening in the lower part of the spine, in utero, that can affect pressure gradients of the fluid bathing the brain, and it can cause the brain to move downward and sit a little bit lower in the neck area, and that can cause symptoms such as hydrocephalus. So a lot to explain about spina bifida, and I'm happy to explain more, but that's just a quick summary.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Nienke Dosa, the pediatrician who oversees the Spina Bifida Clinic at Upstate, and Julia Duff, the executive director of the Spina Bifida Association of New York State. Now, is spina bifida the reason that pregnant women are told to take folic acid?
Yes, the micronutrients are very important for pregnancy, and very well done population-based studies, like public health studies, starting in the early 1980s, and then finally enacted as public health campaign with folate fortification in the late 90s. Studies have shown that B9 or folate is important for the development of the neural tube, and so the recommendation is, in the prenatal vitamins, to have the folate, and for any woman of childbearing age to take the 400 micrograms of folate daily.
So that can be a preventive.
Correct. Yeah.
Does spina bifida run in families? Is it a genetic cause, though?
Well, we used to say that it was multifactorial. We couldn't explain to families why it happened, but there were studies, going back several decades to show an association with certain medications like Depakote. Studies have shown that difficult to control diabetes is associated with neural tube defects. And for reasons that are still not well understood, there are certain populations, for example, Hispanic Americans are at higher risk for spina bifida. The good news is that we know that high dose folate for at-risk families, so for example, a woman who's carried a pregnancy affected by neural tube defect, taking high dose folate, which is 4 milligrams, you need a prescription for this, reduces the recurrence risk for the woman, which is 3 to 5% to less than 1%. So I usually reassure the families I meet with that it's not anything that typically that the mother could control during the pregnancy. We don't understand completely. It's multifactorial. There have been some very interesting studies, population-based studies called TRIO studies, genetic studies, published just in the last year to show an association with a gene on chromosome 22. And I'm sure there will be other genes identified, but long story short, there may be a genetic component in some families, but for many families, there's no history at all of neural tube defects. And to be honest, we don't know why it happens, but we know how to prevent recurrence. So that's good news.
For the annual conference this year, the focus was on mental wellness and disability. Ms. Duff, how did you arrive at that theme?
As we've been discussing, spina bifida is a medically complex condition and requires the support of a variety of healthcare specialists. One area of support that we see lacking as people with spina bifida continue to lead longer, fuller lives is mental health. And starting at diagnosis, when the parents first hear the word spina bifida, they might not even know what it is. It's a lot of stress and life-changing decisions that are being made, and it can be very isolating, especially as kids age and they're reaching different milestones. Kids might feel different, they might look different, they might go to the bathroom different. So all of these things add a layer of stress and anxiety and trauma, and it's not something that is discussed frequently and openly enough. And it's also an area of support that our organization wants to improve the quality of. Anyone can go out and maybe find a mental health counselor or a therapist, but having an understanding of how spina bifida affects the caregivers, the family, the siblings, and the person does require knowing the population. And there's not a lot of specific expertise in that area. So when we put on these types of conferences, our goal is to provide education to people impacted by spina bifida that they can take home with them and share with their network and their community, and hopefully address some of those gaps in care that exist right now.
Now, you also had a transportation summit as part of the conference. What was that about?
So I have been lucky enough to partner with Dr. Nienke Dosa and other nonprofit groups in the central New York area for about 3 years. And when we first started putting on these events, we had to hire a transportation company from Long Island called Tripper to assist with helping people get from each part of the event, whether it's the conference. This year we did a baseball game, and we do an adaptive recreation expo on the Erie Canalway. So in order to do all that, we need accessible, affordable, reliable transportation for our folks who do utilize mobility equipment, whether it's a manual chair or power chair. We didn't have that option in central New York. So we had to bring a company from Long Island in order to do it. And it highlighted to us the need of discussing transportation for people with any, intellectual or developmental or physical disability in order to get them out participating in the community, right? So someone could be employable, someone could want to go to college, but if they don't have transportation to get there, it's limiting their opportunities, it's limiting their options. And it just adds layers of barriers to access and participate in society. There was a grant from the Council on Developmental Disabilities, and when it popped up in all of our emails, we got together with our Central New York working group and said, hey, let's do something about this. And we added that as a second day event to our annual conference.
So as children with spina bifida grow into adults, are some of them able to drive? I mean, what are their transportation options typically?
Yeah, that's such a great question because some of them do. And it's really advanced now. Some people with spina bifida have no vehicle modifications. Some people with spina bifida drive using hand controls. And as we're moving forward into, self-driving cars, there's all these opportunities for people with disabilities as technology continues to grow and expand. If someone does not drive, they typically rely on a form of paratransit. In Central New York, there's Centro, and it typically follows a fixed bus route with public transportation, with a little bit of flexibility there where people, especially with physical disabilities who cannot drive themselves, can utilize this type of transportation to get to medical appointments, to get to work. The barrier with paratransit, of course, is funding. It's not serving, the largest population, so it's not heavily funded, which means services can be unreliable, not timely, or inconsistent. And we know that these providers are doing the best they can with the means they have. But that was a piece of why we wanted to have these conversations over the weekend, because we do need to advocate as a community, allies and people with disabilities together to say, hey, this needs to be improved. This is affecting our quality of life and our ability to participate in society. And I know, Nienke, I'm sure you have information to add about this weekend.
Well, I was just going to say kudos to Christopher Tuff, the head of Centro, who participated at that excellent transportation summit. It was really well organized. We also, we have so much expertise at Upstate. There is an occupational therapist who's a national expert on driver evaluations for people with disabilities. And Beth Rowland was one of the panelists as well. It was an excellent summit, and it's a very important topic. And Syracuse actually is quite forward-thinking about transportation and access, especially in the realm of inclusive outdoor recreation. Our group has done some work around power wheelchair charging stations along the Erie Canalway in our harbor area. And we have excellent partnerships in place with Syracuse Departments of Parks and Recreation and the Erie Canalway statewide. But it just was great to get together in person and identify solutions and strategies statewide.
Well, before we wrap up, Dr. Dosa, I wanted to ask about the reaccreditation. Is that something that's required?
It's not required, but it's a very nice, feather in our bonnet, so to speak. At our regional Spina Bifida Center, there are about, estimating about 30 centers nationwide that have this accreditation, and through the Spina Bifida Association of America. And we have to have certain staffing available on site. So we have neurosurgery, urology, orthopedics, social work, very important. And we have the Spina Bifida Association of New York State. Kathleen Watts, who works with Julia, is on site with us for patients to meet with at our office visits. I think the key to getting accreditation, there are 10 different parameters, but the key in my mind is to demonstrate coordination of care and addressing all aspects of life, not just the medical, but the social participation, and also the cognitive and psychoeducational concerns that our patients have. So I'm very proud that our center has been reaccredited, and I think that's in part due to our collaboration with Julia and Kathleen and the Spina Bifida Association of New York State. It's been a wonderful collaboration.
Now, do you typically see the complications of spina bifida improve with a person as they age?
So there are different health concerns depending, in different phases in life for patients with spina bifida. And that's why it's so important to have a regional multidisciplinary program. So for infancy, it's the neurosurgeon, very, very important to have high quality neurosurgical care. And these days, fetal surgery that holds a lot of promise and has been shown to reduce the need for shunting and result in better mobility outcomes. So neurosurgical care, and sometimes that's these days even prenatal neurosurgical care. Orthopedic care, we have top-notch pediatric orthopedic surgeons here offering scoliosis surgery and growth rod surgery. So we really have a lot to offer, for the school age and adolescent patients who need orthopedic care. Our urologists also top-notch. They offer, along with the pediatric surgeons, surgeries to help with kidney health and continence, both bowel and bladder continence. So that's a huge quality of life concern. To answer your question, do medical complications or medical concerns improve? I think they change. And in adulthood, and again, most people with spina bifida in the U.S. are adults, not children. That's really important for us to be aware of. In adulthood, it's skin health, prevention of pressure sores. That's a really important aspect of care. And then kidney health, that also is very important.
Would add the mental health and the weight management, and that is where the collaboration between our organization and the work being done in Central New York has really been able to hone in on it. So we have this wonderful clinic seeing people to address those medical needs, of course, and then an event like On the Trails where we're showing people how to be active and get involved in recreation, which has physical and health benefits throughout the Erie Canalway, which is accessible, is critical because people with spina bifida are more prone to have issues with weight and mental health challenges. So it's a beautiful partnership that sees the person as a whole person and looks at how we can really support the unique needs of this community.
Well, it's really good to know about this. Thank you both for making time to tell us.
Thank you.
Thank you.
My guests have been Dr. Nienke Dosa from Upstate's Spina Bifida Clinic and Julia Duff, Executive Director of the Spina Bifida Association of New York State. The Informed Patient is a podcast covering health, science, and medicine brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.